do you change the approach to wound care so that you could speed up wound healing?
So give me like a practical example. Somebody comes in with like a 6-month open ankle ulcer, and you would test deficiencies and then give them back these vitamins and minerals. Is that what you're thinking?
That would be one way. Another way is to say if your if your blood flow is adequate, and another way of stating that, if your leg is not amputated, the blood flow is adequate to at least maintain the limb.
The circulation to the limb, exactly.
Correct. Okay, so that even if circulation to the limb is limited, it's enough.
Right.
And therefore, you have an issue of tissue oxygen release. And what are the nutrients required for optimal tissue oxygen release?
Like thiamine.
Like thiamine, like the bioflavonoids, okay, which are cousins to vitamin C, which are inherent in optimal collagen function. And really thinking back to all the diseases of malnutrition, what happens when you have scurvy? Your tissues break down, you have open wounds. And really how we know why we have good examples as to spontaneous wound generation, of which scurvy is an example. And how we fail to recognize these things when they don't present as gross disease.
So practically, you would. What is the project?
So the practical project would be appropriate supplementation and seeing the wounds heal. So for example, one could heal a chronic leg ulcer with edema, and in 6 to 8 weeks. Just by paying attention to optimal supplementation, specifically with thiamine, folic acid, the vitamin C analogs, the bioflavonoids,